looking into going into a career path down global health. So a big thing for me is that healthcare is a human right. So there are a lot of families in America and around the world that don't have access to proper resources for their health. And this leads to so many deaths per year that are 100% preventable if we would just intervene. So a big thing for me is going out to these countries and being able to provide health services that they otherwise wouldn't have.
I chose nursing as my career path, and so I'm currently in school to get my BSN. And I chose nursing because I feel that being a nurse has so many different components to the career itself. You're an educator, you're a caretaker, you're an advocate for your patient, and I feel like I've always been very proud of knowing 2 different languages, Spanish and English, and nursing to me is another and is an additional language, and it's not just a language that communicates with one other culture, but it's a universal language. The goals of nursing, the caretaking, the advocacy towards your patient remains the same wherever you are in the world.
So I plan on majoring in biomedical science to become a pediatric psychologist. The reason why I chose that career is because I have lived through a lot of family conflicts in which my family suffers from a lot of mental illnesses, and it's been hard for me, and I want to be able to help the children that suffer through that because I know it is a nightmare. So I want to take part in research.
I've chosen a path in clinical psychology, a research career path specifically. I focus on substance abuse as well as mental health and stress.
So the career path that I've chosen is actually pharmacy. I actually go to the University of Houston College of Pharmacy, and I'm a year 3 pharmacy student.
I plan to attend the University of Houston and major in biochemistry to hopefully become a successful pediatrician.
I fell in love with a career in psychology and clinical health psychology because I feel I can really give back to my own community and just make a big impact.
The reason I chose pharmacy is because pharmacists are the most accessible healthcare professionals around. So just think about any of your local retail chains. You can come in and ask about a variety of illnesses or things that are bothering you that might need an over-the-counter medication.
Short-term goals I've set for myself are whenever I go to college, I'm looking into already getting involved in abroad programs and mission trips that will help me already get connections for potentially gathering people who would want to go with me.
So short-term, I'm graduating this year, and I'm planning on applying to graduate school for clinical psychology. I hope to, in the next year, develop more research experience before going to graduate school.
My short-term goals would definitely be just surviving 1 week at a time. Every assignment, every exam, every clinical that I get through is definitely the way that I use to attain my long-term goal, which is ultimately finishing my BSN at Texas Women's University.
I just want to excel in everything I do. I know as a Hispanic, we always get put aside due to our background and our economic restrictions, and I want to exceed from that.
And for long term, I would say it's just medical school in general.
Long term, I see a career of research in clinical psych. I love clinical psychology because I can make a broad impact with developing and implementing policies or a personal impact in providing clinical therapy to people one-on-one.
Long-term goals, like I said, I definitely want to pursue a residency, and I would love to practice as a clinical pharmacist, like I said, in infectious diseases, specializing in HIV, hopefully.
Try to strive from our countries to establish universal health care, because Canada and Europe, they're striving on this system, and somehow we spend so much on our healthcare system, but we don't get as much of a benefit from it as the other countries do. So that is my big goal.
I plan to make a change in the lives of many children who may feel lost and afraid because I've seen my family suffer through it. and I want to help them out.
I know that the Hispanic community is one of the most underserved communities in our city and in our country as well, especially our elderly, which is a very huge chunk that still remains in poverty. So, and I know that our elderly population is increasingly getting larger and larger. So I definitely see that as an area I would like to help.
This scholarship means a lot to me. My family does not have much money, so whenever I speak of a dream of having, of going into the prestige of a medical school, a lot of people deny that dream and they say that I'm not going to make it because I don't have the money. So this scholarship opens so many doors for me, and I thank everyone who made this possible.
Winning this scholarship was really just an investment in my future. Being a DACA recipient, I feel like I have to work a little harder for things. The financial resources aren't always there, so this is huge for me.
It's more than the money to pursue my career. It's a really big sense of validation that some strong leaders in the Hispanic health community recognized my contributions and would like to see me grow more in this community.
It was such a blessing, and I'm so thankful because it just gets me one step closer to being able to get the education that I would need to pursue my career as a doctor.
I cried and I apologized to who was speaking to me because I was very excited. I have had some hardships during this school year, and this scholarship just meant a lot to me.
I was actually in my room and my mom was there, and I was looking through my emails, scrolling down, which I rarely check really, and I saw it and I was like, whoa, I actually got it.
I was really surprised. I knew that this scholarship application would probably have a lot of applicants, and I was hoping that I'd be a good candidate, and I guess I think I always think of myself a little less than what I can do. So I was surprised, and I was also proud of myself, proud in what I've accomplished.
The fact that this was a Houston-based scholarship that literally anyone from any health profession could have applied for, I was very shocked and humbled and grateful to receive the scholarship.
I found out while I was about to go to bed, I had checked my emails, and then it was congratulations, and I was like, oh my gosh, I think I got it. And so I went and I called for my mom, and she was like, oh my gosh, and we were just both so excited, and we couldn't believe it. We were like, is there a second phase? Is there, we were so just in awe that I had actually received it, so it was great.
I had to read the award letter over again from the beginning to make sure. I was like, is it for me? And then look at the bottom. Is it toward me? It's not a mistake or anything. And then I told my family, because they have been my biggest supporters throughout my entire education career.
I would just definitely say to have faith in something, and never give up, because so many doors open, and to keep applying, keep working towards opportunities.
Don't let anyone else tell you that it's impossible, because it might seem tough, but it's doable.
To inspire other people and to show people who you are and to follow your dreams, you have to be yourself.
I think the biggest thing I would say is not comparing yourself to others. I struggle a lot with that, but being able to overlook that it's only the best that you can do, and you need to strive for what you can do, and it doesn't matter what anybody else is doing as long as you know that you're doing the best.
First and foremost, I would definitely thank my mom, my aunt, my entire family. They have been my biggest pillar in my entire education career, and as well as the Hispanic Health Coalition for providing me with this opportunity, and the Scholarship Awards Committee for deeming me a notable enough candidate to accept this award.
I would like to thank my parents because they are always pushing me. They're always there, regardless of what happens, regardless of what others tell me, and regardless of the hardships that come upon my way. They're always there, and I want to thank every sponsor here, because without them, this wouldn't be possible for me, and I want them to know that they're opening many doors for me.
I'd like to thank my mom because, both my parents, because they've always led me towards the healthcare path, and especially also my teachers, especially my healthcare and health science teachers.
My mentors, Dr. Wright-Soul, Dr. Luz Garcini, and Dr. Hernandez have all been super critical in developing me professionally and giving me the opportunities to explore research, and they really just have enabled me to be the best that I can be.
I would love to thank the committee for selecting me and acknowledging and recognizing my achievements, and giving me more of an opportunity to pursue my career, giving me more of an opportunity to pursue my education. And I would also, of course, love to thank my family, my mother, my father, my brothers and sisters. I have a pretty big family, and they're always very vocal on Facebook. Anytime I accomplish anything, they're always the first to comment and say, "Love you, Dios te bendiga,"
First and foremost, I would like to thank my family and my mom. She's a single parent and she raised me all by herself, and because of her, I've been really dedicated throughout high school. She's motivated me. She's always supporting me no matter what I do, and my family is the same way. Whenever I got some acceptances from colleges, they're all so excited. They were like, "Oh my God, you're going to be the first to go to college," and it's just so heartwarming knowing that whatever I do, they're going to be right there behind me, with me. And I'd also like to thank the Hispanic Health Coalition organization as well for giving me this great award.